Each breath monitored, each heartbeat measured, each life hanging in the balance. This is the critical care unit at Russels Hall Hospital in Dudley. And the place Dot Oliver has been fighting COVID for the last 50 days.
You look younger than her.
Finally, the 75-year-old grandmother is well enough to move to a ward.
I'm getting better. But I still can't. That's all I can do. It's like your body's gone.
But you're a lot better than when you came in.
Oh my God. The doctors and the nurses have been absolutely wonderful. They've helped me through this. And I love them.
Oh.
I do, I really do.
Her bed will be filled immediately, such is the demand.
Normally there are 16 patients in this unit, perhaps 20 on a really busy day. Right now there are 29 patients in critical care here, 21 of them with COVID, all of them so sick that the best that modern medicine can offer is their only hope.
What we've done is opened up a further critical care area through there.
Having expanded to use every available space, the next planned escalation is to take over the hospital's operating theatres.
Some days, obviously very anxious about have we got the ability to treat all our patients. I think we knew it would be a busy, very busy winter, but I think we thought it possibly wouldn't get to this.
In another part of critical care, Harpreet is halfway through her 12-and-a-half-hour shift.
Hello, Julie. How are you doing?
In March, she ended up in intensive care herself, and returning to work has taken a toll on her 3 young children.
They didn't want you to come back?
No, they didn't want. My son doesn't want me to come back to work because he thinks if I go again, I will die. He thinks the hospital give me COVID.
That must be really hard. You're kind of torn between your family and your work.
It is. It's very hard.
And you've chosen the NHS?
Definitely, yes.
This new disease creates new challenges for critical care. Proning people, laying them on their front, is proving beneficial. But turning each patient takes a team of at least 7, up to 45 minutes. That's not time the nurses can spare, so community physiotherapists have been drafted in.
I know some of my colleagues, allied health professionals that are all part of the proning team. A lot of them never have stepped foot in this sort of environment before, so it is quite a scary thing to have to do, but I think everybody's really glad to be able to come and do something to help as well.
So many staff are stepping up, but they can't replace the years of training of an intensive care nurse. Each nurse should only manage 1 patient, but at the moment they're having to care for 2 or even 3.
The responsibilities on the intensive care nurse to be responsible for all 3 of those ventilators and dialysis machines and things like that. Yeah, you do go home with that mental stress on your mind, like have I missed anything or could I have done anything better? It's exhausting at the moment, and for your mental health as well. Seeing so many people so poorly, so young sometimes, passing away, you just go home, it's so difficult.
Remember, these doctors and nurses are no strangers to dealing with death, but dealing with COVID has stretched them to their limits, and the harder it gets for the staff here, the poorer the prospects become for those they are trying to save. Catherine Jones, 5 News.